Hi everyone, this is my presentation on the effectiveness of fluidotherapy and contrast baths. So fluidotherapy starts by placing an extremity through a sleeve into the internal chamber of this machine, which is full of natural cellulose or usually corn husk granules. After that, the sleeve is closed up to prevent any of that material from leaving. Then the machine will start pushing air through the chamber and causing those granules to start moving around. The liquid properties that these granules basically gain from the from the air is why it's called fluidotherapy. Some companies describe it as a dry whirlpool since there's actually not any liquid that's involved in this process. On the machine itself, you can change the duration of the treatment, the airspeed, and the temperature. The heat is given through forced convection by the air and the particles. It also gives tactile stimulation, which kind of gives the effect of a light massage and increases the buoyancy of the limb from that movement, which kind of counteracts gravity a little bit. The average length of a session of a treatment is about 20 minutes. It is a very expensive machine starting at $5,000 to $6,000. And it is marketed to relieve joint pain, stiffness, edema, mechanical or osteoarthritis, increase circulation, and aid in range of motion. So the evidence on fluidotherapy. It increases superficial skin temperature as well as deeper intramuscular temperature. The heat is long lasting, where it stayed for about 20 minutes post-treatment. It also decreases distal sensory latency in the superficial radial nerve. This means that the speed in which action potentials cross in a nerve is increased. This generally happens when the nerve is warmer, but fluidotherapy has a greater chance at causing this because of the increased internal temperature in comparison to other heat modalities that don't really do that. Some conditions that have decreased neural conduction that could benefit from this are like carpal tunnel syndrome, Charcot-Marie tooth syndrome, neuropathies, as well as some other neuro disorders. The combination of heat and tactile stimulation was found to be a great pain reliever, and that same combo significantly decreased edema. And this is on its own without any additional edema reduction techniques. So a quick review on contrast baths. It involves the alternation of an extremity between warm and cold water to create a passive pump. This pump is created by the vasodilation in the warm water and vasoconstriction in the cold water. And remember that Dr. Stockwell said you can have your client do hand exercises and ranging during this treatment in order to be a better use of time, and that you need to create a 2 or 3 to 1 time ratio between the warm and cold water, and that time can be established by the client's tolerance of the cold water. A minimum of 3 cycles is needed to start up this pump. It is a very low cost, accessible, and easily understood treatment. And it's most often used for treating edema, muscle fatigue and soreness, pain, and stiffness. So the evidence on contrast baths. Some benefits include a positive impact on tissue repair post-injury due to the increase in circulation. This brings more oxygenated blood to the surrounding tissues, which could help boost healing. This method is also really commonly used by a lot of different therapists who also claim that they can see the difference within their clients when they're doing this, as well as being able to measure and document that process. One study found that there was a much greater increase in circulation in young adults between the ages of 18 and 30 versus not as much a difference in late middle-aged adults around 46 to 64 years old. This means that the effectiveness of contrast baths is decreased in these older adults, even though they would probably benefit from it more. Some other drawbacks include a minimal intramuscular temperature increase, which means that there might not be as much of an effect on the muscles or joints. There are also a lot of mixed views on the effectiveness of contrast baths on edema. There are some studies that say it does help and reduce edema, and others that say it doesn't really. So it kind of just depends on your client factors in the end. And then there are also other more effective thermal agents that you could be using to create this passive pump alongside active ranging and massage for reducing edema. Contraindications for fluidotherapy and contrast baths. As Abigail already said, you don't want to use thermal agents on areas that have open wounds or with people that have circulatory issues. But one addition to that is you want to prevent the spread of infectious diseases and as well as protect people who have a disease that prevents them from being able to receive any additional heat. This is especially important in fluidotherapy due to the cellulose inside, as well as the higher heat that is used, and just the nature of a shared machine. So some uses of these methods in occupational therapy. The effects of long-lasting heat from fluidotherapy can be used to our benefit due to it increasing extensibility, decreasing stiffness, and helping with range of motion. So by using fluidotherapy at the beginning of a session and maybe doing active ranging inside the actual machine, you could have a better impact on the therapeutic activities you do later on in your session. In a study done on post-stroke patients with edema, it was found that regular fluidotherapy had a positive impact on their ADLs. Using a modified Barthel index, they found that these clients were able to complete ADLs with less assistance after the study. The accessibility and inexpensiveness of contrast baths make it super easy to do it in a session and give it as a home program for someone. Then in pain reduction, whether it's a long-lasting or short-lived effect, whether it's from edema reduction or from muscle relaxation, any of that would have a great impact on occupational therapy, occupational performance, of course. Then the speed of recovery can be increased using these methods. From the increase in circulation, decrease in edema and pain, overall recovery and well-being can be reached much faster. Some future study ideas could be looking into the effects of fluidotherapy on sensation and tactile discrimination, as well as its effect on different skin types. It would be interesting to see how the use of exercises and ranging during contrast baths has an effect on the client, as well as if it has any different effect in just hot or in just cold water. And then lastly, I thought that it would be interesting to see the effect of contrast baths on range of motion after a treatment, to see if it has any or if it doesn't, based on it being a more superficial heat. And here are my references.